Hi, I'm Dr. John Mendelsohn, Medical Director of the Advanced Cosmetic Surgery and Laser Center. SmartGraft is a relatively new device that allows us to extract individual hairs without making any incisions. Our old technique was to go excise and remove a big part of the scalp, leaving patients with incisions that needed to be closed with staples or sutures. So the way the SmartGraft works is after the donor area, that is the area where we're going to borrow hair from, is shaved, we'll give you a cocktail. That cocktail mostly consists of Valium. Valium is a medication that will help you relax throughout the entire process. We'll take you back to the operating room. We'll make sure that we've confirmed the appropriate hairline design, and we will begin the procedure. The procedure begins with you lying usually face down, we call that prone, and the hair has already been shaved, so what we'll do next is localize the area. When we talk about localization, we talk about injecting lidocaine, which is a medication to numb the tissue. It also contains epinephrine, and epinephrine is a solution that helps the tissue vasoconstrict. We can actually watch your scalp blanch. The epinephrine is constricting the blood flow, so throughout the procedure, it is bloodless. We will use the SmartGraft as a tool to slowly extract and suction each individual hair follicle. These hair follicles then are suctioned gently into a tube, into a container that is properly humidified and chilled. After these hairs are cleaned and ready to be placed in the recipient area, they are done so individually throughout the scalp. One of the biggest differences with SmartGraft is that there are no scalpels, sutures, or staples. This is a relatively painless procedure compared to what we do many years ago. Our experienced team has performed more than 10,000 SmartGrafting procedures. It consists of a team led by me, the medical director, as well as our assistants who help extract and place the individual hairs.
My name is Mark Lucas. I'm the clinical director of our hair loss division here at Advanced Cosmetic Surgery and Laser Center. And my responsibilities fall from patient education all the way to what do we eat for lunch during the procedure to making sure the patient's okay after the procedure during recovery. There are many forms of hair loss that we encounter at Advanced. We all have a form of alopecia. And the most common form of alopecia would be the male pattern baldness, where we lose the hair on top, but we retain the hair on the sides and the back of our heads. So the permanent hair that we have on the back and sides of our head is genetically predispositioned to never fall out. So therefore, we can relocate those hairs, put them anywhere we want, and they'll grow for a lifetime. Everyone's hairline is going to be different. We look at a lot of different things when we're designing that hairline. This is not a cookie cutter approach, and that is where the experience and the artistry comes into play. So the first step in solving one's hair loss issues is to come in and find out, are you a good candidate for this? And we're going to take a look at your donor hair, which is basically the hair that you have on the sides and the back of your head, and we just want to make sure that the supply will meet your demand. Over the last 25 years, technology has really improved in the hair restoration industry. We've gone from the old strip method, that longer recovery, more pain, scalpels, sutures, staples, to now the more advanced follicular unit extraction process where we don't have scalpels, we don't have sutures, we don't have staples, and a very quick, swift recovery and just unbelievable results. A follicular unit can consist of 1 to 5 or more hairs. When we bring the follicular unit out with gentle suction, it goes straight into our advanced FUE system where it's chilled, lubricated, hydrated, kept extremely safe. Depending on where the grafts are going to be placed, for example, if we're going to be placing in the hairline, the grafts, the follicular units, are dissected into single hairs. So the hairline has been drawn in, and during the second part of the day, we're making recipient sites where each individual hair is going to be placed. It's important to do it in this manner just so you'll have a free-flowing head of hair. No matter if the wind blows, it takes it in any direction, it'll look perfectly natural.
Yeah, so the procedure was relatively easy, relatively painless. Showed up in the morning, kind of went through, I don't know, the explanation of everything. I think I was ready for something a little bit more, kind of in-depth or maybe painful, and it was a pretty simple process, pretty relaxing. We had lunch, a lot of just sitting there talking to the doctor and his assistant as you're going through the process. I was relaxed. It was a relatively enjoyable experience. I didn't have any issues whatsoever really with the whole process. Even if you knew me, if I didn't tell you I had anything done, you wouldn't have known. So it was really a minor touch-up just to make sure my hairline kind of stayed what it was. So it was more of like a preventative thing before I was like, and maybe I never would have gone like really bald, but I just felt like, I wanted to touch it up and have my hairline be full for the next, 10 or 20 years. So, and then, now I have a good relationship with docs. So if I want to touch it up or be more aggressive, certainly I know what the procedure is. So I would do it again.
Advanced Cosmetic Surgery and Laser Centers leading the way in the hair industry by constantly looking for the best tools, the best techniques to give the patient the thickest head of hair possible.
If you'd like any additional information on SmartGraft, please feel free to give us a call, come on in for a private hair analysis and consultation, and we'll be happy to assess your hair loss goals.